You want to know the one thing that people don't spend enough time and attention on before surgery? There's so much time spent on deciding which doctor you're going to choose, what hospital you're going to get operated on, a discussion about the surgery itself. You may even get a second or third opinion from different doctors to make sure that you make the best selection for yourself. But the one thing that people don't spend any time on is anesthesia. Hi everybody, my name is Frank Spector. I'm a medical malpractice lawyer in Maryland and in DC. I've been doing this for over 33 years. If you're new here, please hit that like and subscribe button. That way you can take advantage of all of my videos. We almost have 2,000 subscribers. I want you to be part of this community. Many people ask me, why do I have a YouTube channel? Because I want to have a free resource for you so that you can have your medical malpractice questions answered. Anesthesia is very powerful and very dangerous. The drugs that are administered to you to put you to sleep and to give you amnesia, which means you'll have no recollection of the surgery, are extremely potent. They are putting you in an unnatural state. You don't walk around in a sleep state with amnesia. But if you didn't have these drugs, then you would not be able to withstand the surgery. But most people don't pay any attention to the type of drugs they're getting or who's giving it to them. So let me talk about first an anesthesiologist. An anesthesiologist is a healthcare provider whose job it is to select the drugs that are most appropriate for you and to administer those drugs during the course of surgery. Let's talk about the two types of anesthesiologists that most people will encounter. The first is a medical doctor. These are people who have gone to medical school and have had follow-up training. So they're at the top of the ladder in terms of anesthesiologists. But more commonly, people are given nurse anesthetists. These are people who've been certified. They have a lot of training and experience in anesthesiology, but they're not medical doctors. These are the people that are giving anesthesia most of the time. Why? Because it's probably more cost-effective for a nurse anesthetist to give you anesthesia rather than a medical doctor. I'm not here to say that nurse anesthetists are not good and they're not qualified, but I think it's important for everyone to know that they're not medical doctors. So number one, make sure you ask who your anesthesiologist is going to be. Is it going to be a medical doctor? Or is it going to be a nurse anesthetist? You have a right to this information so that you can make the best choice for you. The second thing that you want to ask is what type of drugs are you going to be given? You may have a sensitivity or an allergy to certain drugs, and you have to be very clear with your doctor and the anesthesiologist about those allergies, because there could be some ingredients in these anesthesia drugs that you're allergic to, but it may not be obvious right up front. That's going to require some more investigation by the doctor. And make sure you have this conversation with your anesthesiologist, and you specifically want to know what type of anesthesia drugs. And the third thing that you want to know is, will the anesthesiologist be with you the whole time? Sometimes what happens is the medical doctor will administer the anesthesia, turn it over to a nurse anesthetist, and never come back to monitor you. So you want to know, will the MD doctor be there the whole time, or will they start the case and then give it over to a nurse anesthetist? Why is this important? Because during anesthesia, it's very important that your vital signs are monitored. Your blood pressure, how you're breathing, how are you dealing with anesthesia? I've had so many cases where people have had catastrophic injuries because the doctors failed to monitor the vital signs, which showed that the patient was not doing well under anesthesia. So take the time to make sure that you understand anesthesia, who's giving it, what kind of drugs are giving it, and who will be there during the course of the surgery so that your vital signs can be monitored. Thanks for watching this video. I hope to see you again soon.